A very warm good morning and thank you so much for making time for this Health Friday Health Discourse brought to you by Capuchin TV in partnership with Misericordiae Hospital. As it is the tradition, we are all set to bring you this conversation. Remember, you are a part of this. You can be part of this by sending your questions, sending your feedback on our social media platforms. Make this interactive because it's about you. That's why we are here today. And I'm joined by one of the doctors from Mater Hospital, and allow me to introduce him to you. He's not a new face. Before we proceed, welcome, Dr. Mugo.
Thank you so much.
It's good to have you yet again.
It's good to be back here again.
So how have you been?
I've been very well, continuing to build the nation.
Oh, great.
Yeah.
That's the spirit. So today we are set to discuss this subject, fainting. I know there are so many issues or medical conditions that are associated with fainting, so we're going to get to know from the expert, what does it mean when you faint? How serious is it, or at what point should you seek medical attention? The first aid that you're supposed to administer to someone who falls unconscious, among other pertinent issues that you need to know surrounding this subject. My name is Sasha Elizabeth. Remember, our number is 0717-424-866. So welcome, and let's talk health. Welcome back.
Thank you.
For the first session.
Yes.
All right. So first, as usual, we start with the basics, the very basics. So could you please tell us what is fainting? Is it the same as passing out?
Well, passing out could be used as a simple term to describe fainting. The medical term we use is syncope. And basically, fainting is usually a brief loss of consciousness that happens suddenly, and then the person tends to recover quickly and without much problem afterwards. And this is usually because of a reduction in the blood flow to the brain, or a reduction in the level of oxygen to the brain, or sometimes even low blood sugar can cause one to faint. And they also tend to have a loss in their ability to move, so they're not able to have their normal posture. So that also happens during fainting. And usually within a few seconds to a minute, they're able to recover their consciousness.
All right. So now, how common is fainting, especially in Kenya?
It's quite a common issue. We see almost about 1 to 2% of the visits to our hospitals tend to be fainting related, and it's an issue that we most of the time tends to be the simple causes that cause fainting, but a few times we can have some serious causes which we need to evaluate and rule out and be able to manage the patient appropriately.
How is it common? Like, is it more common among the young or the older? Which age bracket is more affected by this?
It's usually common among middle-aged and older individuals. In older individuals, it's because some of the medications also they do take, for example, for blood pressure, can cause their blood pressure to go lower than normal. And they also tend, for people who maybe because of their busy schedule, they skip the regular meals, or they stand a lot in direct sunlight. So that's usually the working population. So it tends to be commoner in adults. Yes.
So these are just some of the causes of fainting.
Yes.
Or rather the conditions that predispose one to fainting. So what are these the common causes that can really expose someone to feel fainting?
Well, we can group the causes of fainting into three. The first one is what we call the reflex type of fainting, which is usually the most common, whereby, for example, people who stand under extreme heat, or sometimes they stand for too long, prolonged standing, and some individuals also may be exposed to for example, a traumatic situation that can cause one to have a high level of anxiety. And these are things that can cause decrease in their blood pressure and reduce the amount of blood that's going to the brain, and they can start to feel faint. There are other people who, as I said, skip meals, and low blood sugar can also cause them to feel faint, or they're dehydrated, or they're having some source of bleeding that can also cause them to feel faint, whether internal or that's obvious. So those tend to be the most common things. Then there's what we call the orthostatic type of fainting, whereby there are people who, because of some, when they stand up, their nervous system is not able to adequately compensate for the change in blood pressure. So they can have lowering of the blood pressure when they stand up rapidly, and they can start to feel faint. So there are also people who are on some medication, for example, for blood pressure or for depression, or for some other mental illnesses like schizophrenia, that some of these medications have side effects that can lower the blood pressure. Then finally, there's usually what we call the cardiac type of fainting, which tends to be related to problems happening in and around the heart, but that tends to cause the more serious type of fainting, but we're going to discuss that.
Okay, so yes. When we talk about severe causes of fainting, what do we refer to?
So this tends to be related to the heart. Sometimes the heart can have an abnormal rhythm. There's the electrical system that regulates how the heart pumps. So sometimes there's a problem in the transmission of impulses in the electrical system, which can cause what we call an arrhythmia. So this can make the heart to pump less amount of blood than it should, and the heart rate may go lower than normal, and that may reduce the blood supply to the brain. On the contrary, sometimes also the interference with that system may also cause the heart rate to go up. So the heart may beat faster and it doesn't get enough time to fill, and therefore not enough blood as well is going into the brain. So that can also cause one to feel faint. And there are also other problems with the structure of the heart, what we call cardiomyopathies, that can also cause the heart to be inefficient in pumping out blood. There are even causes, even a heart attack, where there's the blood supply to the heart is interfered with because of maybe formation of a clot, and that can also be a very serious thing, and can, if not addressed quickly, can even lead to us losing the life of a patient. So then maybe the last one that we would be mainly concerned about is, we had talked about it at another time, pulmonary embolism, which is a blood clot in the lungs. So the blood clot in the lungs can impair the ability of the heart to pump out blood and cause the right side of the heart to fail, and that can also reduce the blood flow to the brain and cause one to feel faint.
So in essence, severe causes revolve around the cardiac system?
Yes, that's right.
Okay, thank you. Now, what makes a person to drop unconscious, or okay, maybe before we get to that, what happens before fainting? Are there some signs and symptoms associated to them that could be an indication that of fainting?
Yeah, yes, there are. We usually call this a prodrome, which is some signs that precede the occurrence of fainting. And commonly we tend to have, sometimes the patient may feel a bit sweaty, they might feel a bit lightheaded, they might feel hear a ringing sound in their ears. Sometimes they may have a bit of blood vision. So those tend to be the most common symptoms that they may get before a faint. Yes.
What about nose bleeding? Because when we were discussing this topic, someone asked about nose bleeding. Can it be a precursor of fainting?
If nose bleeding can have a variety of causes, and usually the most commonly is related to either trauma, if someone is picking their nose, or if someone has an upper respiratory tract infection. But it's not a very common thing that accompanies fainting. Yes.
So fainting, can it be an indication of a serious underlying medical condition?
Yes, it can. It can be it can tell us that there's a problem with the heart that's going on, and sometimes a problem with the brain. So that needs to be appropriately investigated based on the signs that the person has, and so that we're able to deal with the issues appropriately. Yes.
Cases of expectant women fainting, especially during the first trimester, have been common. Is it normal for a pregnant woman to pass out?
Pregnancy is a very delicate state to begin with. There are hormonal changes that take place, and some of these hormonal changes can cause changes in the blood pressure, and some of these pregnant women also tend in the first trimester to have a lot of morning sickness. So they have nausea and vomiting, a bit of some dizziness, and they're probably not able to take enough fluids. They're not taking regular meals because of the difficulties, and that may predispose them to fainting. And as the pregnancy progresses, it's also important to say that as the uterus gets larger, because the baby is growing, and the uterus can put pressure on the blood vessels going down into the lower, the extremities, the legs, and especially when they lie on their back, that can cause impaired blood flow back to the heart, and which would also compromise the blood supply going to the brain, and that can cause faintness. And so we usually need to advise them that when in latter stages of pregnancy, they need to lie on their side more. They need to try to take regular meals, not skip their meals, remain well hydrated, and that usually helps them to avoid fainting. Yes.
Great. So that's for pregnant women. What
Yes.
about these other patients? What's the first aid for someone who has fainted?
So when you're in a situation where you witness someone has just fainted, there's not too much you can do, but there are a few things that you can do that can be helpful. Firstly would be maybe to loosen their collar, or to loosen any tight clothing or belts, because one of the causes of fainting can be some people have what we call carotid sinus hypersensitivity, which just means there's some sensors around the neck vessels that regulate blood pressure that can become oversensitive. So when maybe some men are shaving, it can trigger them to, especially with a machine, can trigger them to faint. So loosening their tight clothing, you can raise their legs to about the level of the heart, which is usually about maybe 30 centimeters. And you also need to check if they're breathing, and check if they have pulses, and if maybe they're not breathing as normal, or they don't have a pulse, then if you're a trained medic, then if there's no pulse, you need to start CPR. But if they're not breathing, maybe you need to, or not breathing well, you can call for help, call 911, or involve any other relevant medical personnel that would be able to at least escalate the care for this individual. Yes.
We've seen some people laying this person and making the feet putting them at an elevated place, and then making them to sniff some spirit. Is that advisable?
I haven't seen any science that supports the sniff in the spirit, but the point of elevating the legs is to improve the blood flow to the heart. And as you improve the venous return, then the blood is able to be circulated to the brain.
And then there's this other one where they use some onions and salt to rub the palm and the feet.
Well, I guess these are maybe they've borrowed from traditional medicine, but I don't think there's any evidence for that.
But would you advise someone to apply that?
No, unless you maybe want to use it as your perfume. But I think if for someone who has not fainted and they feel that they're about to faint, also some of the things that they can do is maybe have open the windows and maybe have a snack and sit down. Those are things that can help to prevent them maybe from progressing to an actual faint.
So when you are by your own, or when you're just on your own, and
Yes.
then like you're going to drop unconscious,
Yes.
can you follow such procedures to prevent yourself from falling unconscious?
Yes. So as I mentioned, ensure that you're in a place with good circulation. If you're standing, you need to sit down. And some people do feel faint when they, let's say you've been sleeping for a while, you've been lying on the couch or sleeping in bed, then you get up very rapidly. That can cause a sudden drop in blood pressure that can cause one to faint. So it's also advisable, if you've been lying down for long, then you sit up first for a little bit, then you can now be able to stand, so that there's a better transition in terms of the blood pressure. So if we're in a busy society, so it's one of the things that's common again is low blood sugar. So it's also good to bite a snack when you're feeling faint. Maybe you've not been able to do that in the course of your busy schedule.
All right. Thank you, Dr. Mugo. Now, the brief period of unresponsiveness often makes the person to drop down or fall on the ground. So what would you recommend in the event that they injure themselves in the process? What should the people around or themselves do once they recover consciousness?
So once if one faints, and we said that it's usually a rapid, brief loss of consciousness that has a rapid recovery as well. So if the recovery is a bit longer, or if the individual has a significant injury, then we need to investigate. You need to bring them to the hospital as quickly as you can, and we need to investigate if there are other underlying issues related to their heart or their brain that have contributed to the fall. And we need to rule out other things like strokes, like even just a seizure, which tends to have a period of maybe some prolonged loss of consciousness. Sometimes they bite their tongue, sometimes they lose control of their bladder and bowel. And so we need to check if there are other issues that need to be addressed. So it would be advisable at the scene of the incident to facilitate a fast transition to a hospital setting.
So even if this person is bleeding, you shouldn't do anything. You shouldn't try to maybe stop the bleeding or tie the wound? If
you can identify the source of bleeding, then you can use a clean cloth to just wrap it around and put some good amount of pressure. Then after that, of course, we need to be able to deal with the issues in a more controlled setting in a hospital. So you'll still need to quickly facilitate their transfer to a hospital. Yes.
Thank you very much, dear viewer. It's time to take a breather. We'll be right back with more on our subject, that's fainting. Stay tuned.
Capuchin TV, your Catholic identity.
All right, welcome back, and we are really glad that you're still keeping us company here. Not just keeping us company, but also send your questions, send your feedback and your comments. Let us know where you're watching this from. And just to remind you, we are talking about the subject fainting, and we've tried to understand what it means in the context of the medical context, that is, and the signs and symptoms, first aid, what you're supposed to do, especially when you're alone or when there are people around you, what they're supposed to administer to you, and try and avoid, you heard it from Dr. Mugo, try and avoid these traditional ways of resuscitating someone or trying to bring them back to consciousness. So welcome back to our second session, and we move on swiftly. Remember, keep your questions coming, keep your comments coming. We're going to sample some of them when time allows. So welcome back, Doctor.
Thank you.
Okay, so now at what point should one be brought to hospital? Because you've heard all about fainting, how it manifests itself, so now at this point, at what point should the person be rushed to hospital?
Just to recap, we said that the patient should have a brief period of loss of consciousness and a quick recovery. And of course, they'll have lost their muscle tone. And if the recovery takes too long, and if there is no easily identifiable trigger, for example, if the patient was at a political rally and it was very hot, they didn't have an umbrella, and they fainted and they're able to recover quickly, and there are no other issues. The patient is quite alert, they don't have any difficulty speaking, they didn't get any injuries, then at that point it may not be very necessary.
Medical attention.
However, there are red flags that would warrant medical evaluation, which is especially if the fainting occurred after some exercise, or you think it might have been a convulsion, they had some jerking body movements, or if they had very severe headache or severe chest pain, or their heart was racing faster than normal, or what we call awareness of their heartbeat, or they have some severe low back pain.
Welcome back, dear viewer. We apologize for that technical hitch, and I would like to laud our technical team for moving swiftly to fix it. So we move on swiftly with our conversation on fainting, and with me in studio, just to remind you, is Dr. Ndirangu Mugo from Misericordiae Hospital. Okay, sorry for that inconvenience.
It is well.
Yeah,
Yes.
all right. So we were talking about when someone can be rushed to hospital. At this time, you know, with the rising political temperatures and the campaigns that are going on, so there's a lot that happens. People run under the sun, congestion, the helter-skelter. You can find that someone has fainted, but most people do not really see the need. After recovering, they do not see the need to go and find out if there's any other precursor that could be raising red flags. What's your take about that?
Well, most of the time the causes of fainting tend to be the non-serious causes. So if the trigger is easily identifiable with certainty, and there are no other red flags, then it may not be very necessary to come to hospital. But if there are red flags such as chest pain, palpitations, severe headache, severe back pain, or difficulty breathing, or a prolonged period of loss of consciousness, or jerking movements, the arms or the legs, then we may need to review them. Or other things like maybe some injuries like tongue biting or an obvious head injury, or obvious bleeding from any other part of the body that may have suffered injury during maybe the process of falling down. So those are issues that we may need to evaluate and be able to investigate and manage as appropriate in a hospital setting.
Thank you. Now, on our treatment methods, how is fainting treated when someone is brought in, especially one who was partially recovered and those who are still probably unconscious?
Well, when the individual is brought into the hospital, the first thing is usually to do a clinical assessment. So we have to assess first, we take their vital signs. So we are primarily concerned about their blood pressure. If the patient has already regained consciousness, then we'll be interested to take a blood pressure when they're lying down and after a few minutes of standing, just to see if we could be dealing with orthostatic hypotension, which could be a cause of fainting. We also need to check their pulse rate. A very high or very low pulse rate could be pointing us towards a cardiac issue, which may need to be managed. If the pulse rate is very low, sometimes some medications can be given, such as atropine, or if the pulse rate is very high, then some medications can also be given to reduce it, such as beta blockers. Then we're also interested in the temperatures. Sometimes an infection can also cause the blood pressure to go low, especially the very severe infection, what we call sepsis. So we're also interested in that. We're also interested in the oxygen saturation. Sometimes we mentioned that a blood clot in the lungs can cause one to have a fainting episode. So usually it tends to come alongside a reduction in the oxygen level in the blood, and that will need to be addressed quickly with maybe some supplemental oxygen, and we may subsequently do a CT scan of the chest to look for a blood clot, and blood test we call D-dimers. Then we also will do a full physical examination. We are concerned mostly about the neurologic system. We check maybe if someone has weakness on one side of the body, or deviation of the face. That's something that could be in keeping with a stroke. A stroke can also mimic just the regular fainting. We're also interested to listen to the heart sounds, listen if there's an abnormal heart sound, what we call a murmur. That could be a sign of some heart disease that we need to address. And then after we've fully examined the patient, we also check for things like dehydration. Sometimes we may need to, we notice that the mouth is dry and maybe the blood pressure is low, and we may need to put some IV fluids just to get the blood pressure up, and the patient's consciousness may be restored if they haven't recovered fully. Then we also move a step further. Now we may do some investigations, and primarily we do what we call the ECG, the electrocardiogram, which checks the waves of the heart. And if we notice an abnormal rhythm, it tells us that there is a problem in the electrical system of the heart. And depending on the rhythm problem that's detected, it will determine the course of treatment. And oftentimes we may need to involve a cardiologist. If it's an emergency, they may need to come to the department. If not, then they may be able to advise us on the phone or via telemedicine. Then we may also do some blood tests to check the blood level, a low blood level, which tends to be common even in pregnancy because of issues of iron deficiency. And people, for example, ladies who have heavy menses, or now with common gut issues like H. pylori, where you can have some hidden blood in the stool. You have some dark stools over time and your blood level becomes low, so we need to check that. We'll need to check, importantly, a blood sugar. because that can also cause one to faint. And if the blood sugar is low, then we may supplement with some intravenous dextrose. And just to go back, for the blood level, if it's low, we may plan for blood transfusion, depending on the level, if it's very severely reduced. Then we may also check the blood electrolytes, sodium, potassium, chloride, and those are things that can be abnormal, maybe because of issues like diarrhea and vomiting. And we would need to, and low levels could also cause one to faint, especially things like a low sodium level. And that can be corrected using IV fluids as well. Then there are other additional tests that may be done, but based on what we consider to be the problem. Sometimes if we think there's an issue happening in the brain, we may need to plan to do a CT scan or an MRI. And there are other tests that may be done by a specialist. For example, if we think someone is having some reduced blood supply to the heart at different levels, they may need to have what we call stress testing done by the cardiologist, but at a later time. Yes. Then in terms of treatment, it will depend on what is the cause that has been identified for the fainting. So that will largely vary. Yes.
All right. So now, before we go to the preventive measures, allow me to take some of the questions we have, and I'd like us to go step by step. We have Faith Nucho from Kimana is asking, is it advisable to use a piece of rubber to insert a piece of rubber in the mouth when a person has fainted? I think she's asking if you can place something, maybe a fabric, stiff fabric or rubber, to prevent the person from biting their tongue.
Usually not, and the reason is because fainting is slightly different from convulsion. Okay, so in fainting, the recovery is quicker. The period of loss of consciousness is quite brief, and they tend not to bite their tongue. And because they recover quickly, we are not concerned that the tongue will fall back and block the airway. But in a convulsion, that's when they tend to, or what we call seizures, that's when individuals tend to bite their tongue, and that might be necessary. But for just the common type of fainting, it may not be very necessary.
Then this is Paul. I think Paul is saying in Kilifi, and he's asking, what if the person is epileptic and they faint? What am I supposed to do? I think that's is it a whole different topic, or could you just give them some insights on how to go about that?
Well, you could some of the things you could do is just make sure the area where they're lying is clear. There are not any things that could cause them further injury. And then don't restrain them, okay? And if usually the convulsions tend to last about 5 minutes, but sometimes if you notice that it's prolonged, then you ought to bring them to a hospital so that they can get some anticonvulsants to stop the convulsion. So usually in that setup, maybe would be to just make sure to make them lie on their side and to make sure the area around them is clear so that they don't injure themselves.
Okay. And then the last question, he did not indicate the name, but he's asking that can someone die after passing out? I think we've heard of cases of people collapsing and dying. Could this be just because of a normal fainting?
That now would, of course, that is a minority of times. If, for example, a person has an abnormal heart rhythm, and they can go into cardiac arrest, which would cause them to faint and or to collapse and pass on. So they would tend to, so this are usually people maybe who've had a predisposing condition. Maybe they've had issues with their cholesterol or blood pressure, or they've been on treatment for some heart disease. And some may not even have been on treatment and just happens as a single, just untriggered event. So it is a possibility, and they'd still need to be brought into a health facility for us to determine whether or not they have passed on.
Okay, thank you very much, Dr. Mugo. Now, as usual, in every given medical condition, you recommend, or people recommend, or would prefer to prevent the situation rather than having to grapple with the disease and the treatment modalities. So how can fainting be prevented?
Well, the common causes of fainting can be prevented by avoiding standing out in direct sun for too long, and scheduling to have regular meals to avoid low sugars, and then avoiding very tight clothing, especially around the collar, the neckties, and the buttons of the shirts. You can see I'm not choking myself so that I don't faint. So those tend to be and of course, if one is on medications that may predispose them to a low blood pressure, then we may also need to adjust their medications. And then physical exercise is also quite good because it assists blood circulation, so that would also prevent fainting. And then when one is, if you've been lying down for long, it's good to come up gradually and not stand up like a soldier. So you sit and relax, and then you proceed to stand. So those are some things that can prevent one from fainting.
So speaking of tight outfits, when some pregnant women prefer wearing tight outfits, I don't know if that can also increase the risk of fainting.
Well, usually we're just concerned primarily around the region of the neck, because there are some sensors in the arteries around the neck that regulate blood pressure. So if they're pressed a bit more, then that can cause one to feel faint. So if it's tight clothing in other areas of the body, then that's left to the discretion of the individual.
Okay. Thank you very much, dear viewer. Time is against us, and as usual, I'd like to allow our guest to give his parting shot before we wind up.
So fainting is a common issue. Most of the time it tends to be non-harmful, sometimes can be harmful. If you're not sure where you lie, then it's good to come for a medical evaluation, and we'll be able to advise accordingly. Meanwhile, stay hydrated, exercise regularly, and just remember those things that we've mentioned, and hopefully you won't be fainting soon.
All right. I appreciate your time and the information you've shared with us, with our audience. So we greatly appreciate you for making time for this show today.
Much welcome.
All right. That's Dr. Mugondirangu from Misericordiae Hospital. He has been taking us through fainting and, of course, what you're supposed to do in order to prevent this. And in the event that it happens, how are you supposed to approach it? And at what point are you supposed to seek medical attention? So keep that in mind. Even when you're alone, you know what to do when you feel the signs and symptoms of fainting. So it is important that you consider that. It is time to close the discussion. If only we had time, would have rambled on for a while and try to get more of feedback from you, but keep it coming. We'll try our best to ensure that we get the right people to respond to them. Our camera operator has been Alan Nandiva. Our sound mixer has been Eric Otieno. On the visual mixing, we had Michael Ndegwa, and transmission desk, we had Michael Kibandi. Thank you, team, for your efforts and for trying your best to make sure that we beat the odds to make this successful, despite some slight hitches that happened earlier on. So thank you very much, dear viewer, for making time for this. Remember, every Friday we bring you such informative discussions on health to ensure that you live a healthy life and you embrace healthy practices. Remember, as I usually say, that health or a healthy citizen is the greatest asset that any country can have, and you are part of these statistics, part of the country's population. So stay safe wherever you are. Have a great weekend. My name is Sasha Elizabeth.